You have adenomyosis. That's the reason for your chronic pelvic pain. Also is the reason for your painful period. Oh, by the way, before you leave, it's also the reason why you can't get pregnant. Next patient, please. Was that you when your doctor was giving you the diagnosis of adenomyosis? And even worse, he or had no clue in giving you information when you asked about how adenomyosis could affect your fertility. That's why Dr. Kady is here. This video will do just that. We'll talk about what adenomyosis is and how it can affect your fertility. Hey, this is Hey Doc with me, Dr. Kady. I'm board certified family practitioner. Welcome right here on Hey Doc. We talk women's health, fertility medicine, and pregnancy related matters. So as I tried to sketch earlier on at the beginning of this video, a lot of women get told that they have adenomyosis and they really do not know or understand what that is. You've heard of endometriosis, you've heard of fibroids, you've heard of PCOS, but not many women would have heard about adenomyosis. Although it's out there and many women can have endometriosis as well as having adenomyosis also. You'd be forgiven for describing adenomyosis to be the opposite of endometriosis. Whereas endometriosis, the endometrial lining of the uterus, is found outside of the uterus, with adenomyosis, the same endometrium that is a problem in endometriosis is actually found embedded into the myometrium, which is the muscle bulk of the uterus. So the endometrium, which is where the baby will lie as it grows in the womb as a fetus, actually starts to grow within the myometrium. The symptoms include painful period, chronic pelvic pain, heavy menstrual bleeding, as well as fertility challenges. Adenomyosis affects your fertility in several ways. The first way is by causing uterine inflammation. Chronic inflammation creates a hostile environment, and as a result, implantation will not occur in this type of environment. The second way is by disrupting the uterine structure. Again, this will affect implantation. A very thickened uterine wall as a result of infiltration of the endometrium will cause a distortion in the endometrial lining, and as a result, implantation of the embryo cannot happen. Poor blood flow. So you can imagine if the uterus is enlarged because of all the adenomyosis within uterine wall, the uterus will not be able to receive an adequate blood supply. And this is detrimental to the health of the endometrium. The endometrium, which is where implantation will occur, has to have a good, solid, and a constant flow of nutrient-rich blood. So if the endometrial lining is not receiving this oxygenated, nutrient-rich blood, again, implantation will be affected and it will fail. Besides affecting implantation, there is a hormonal imbalance that occurs in adenomyosis. And it has been shown that adenomyosis is linked to a high level of estrogen. This will in turn disrupt ovulation. And so adenomyosis could lead to anovulatory cycles. So women who have adenomyosis are at a high risk of having cycles in which they are not ovulating. Studies have shown that patients with adenomyosis are at an increased risk of having recurrent miscarriages. And that's not just because of the hostile environment created by the chronic inflammation that exists in the uterine environment, but also because of other factors like hyperperistaltic contraction of the uterine wall, the altered endometrial receptivity, which obviously affects implantation, but also increased risk of miscarriages are observed in these women because of the thickened junctional zone. This is the area between the endometrium and the myometrium. In adenomyosis, this junction is thickened, which again will affect implantation. So let's get practical and let's get real. If you have been diagnosed with adenomyosis and you are considering whether or not IVF is right for you, you can see from the different ways in which adenomyosis affect fertility that the main problem is going to be the implantation of the embryo. So yes, you've gone through IVF, an embryo has been breached, and or we now have an embryo and we're ready to insert it into your womb. It's not just going to be a matter of inserting the embryo in your womb and it's going to be as simple as that. You have a higher risk of IVF failure because of all of these different factors that oppose implantation. My honest and humble opinion as a Christian doctor, I endeavor to be as frank and as honest with my patients. If you've been told that you have got adenomyosis, it's not a condition that is as easy to fix like having a fibroid that can just be removed. Well, I say just go and watch my video on how to fall pregnant with fibroids. With adenomyosis, it's within the bulk of the muscle wall of the uterus itself. So IVF may still not be appropriate for you. I would argue if your adenomyosis is severe, you sit down with your doctor and you have that honest, frank, and transparent conversation and consider whether going for surrogacy might be an option for you. You'd rather go for the option that is more likely to work rather than going through the stress of the time-consuming procedure of IVF, the expensive drug, the emotional roller coaster that you are going to be on, only for it to be likely that it's going to fail anyway, because your uterine environment is a hostile environment for any embryo trying to implant itself. So having that conversation and cutting out the middleman and cutting out all the stresses and going straight for what's likely to work is what I would advise any woman with severe adenomyosis. Whoa, it's not all bad news. I talked about the extreme before going into the extreme in a gentle manner as I normally do. So, can you get pregnant naturally if you have adenomyosis? Yes, many women with the milder form of adenomyosis have fallen pregnant naturally. Now, note I've said mild. If you've been told that you've got moderate adenomyosis and you are still keen on trying to fall pregnant naturally, go straight for a fertility specialist who may try the first line treatment, which is an oral contraceptive pill, or a gonadotropin or progestin therapy. These not only help with the symptoms, but attempt to shrink the endometrial tissue found within the muscle wall. In severe cases, there have been some fertility specialists who have attempted myomectomy, and that simply attempts to remove the endometrial tissue from the uterine wall. Now, the trouble with that is that obviously you can't go too deep into the uterine wall because you risk scarring, you risk also perforating so it's a very delicate surgery that should only be attempted by a surgeon who is very experienced in the field, and even then you still have risk. If God's grace you didn't get a uterine perforation, there are other risks like infection, and also when healing occurs you may get scarring. Now remember, with adenomyosis it can reoccur, so you can remove the endometrial tissue but it may grow back into the uterine wall. So if you go for an adenomyomectomy for the purpose of trying to conceive, once it's been removed and the surgeon reassures you that a lot of the tissue has been taken away and you want to get pregnant, you need to get pregnant fast. If your uterine wall after the endometrial tissue has been removed is less bulky and there's less inflammation going on, then you could consider going for IVF. Now, Remember, if you've just had this procedure, you need to give your uterus time to heal and for the inflammation to settle before you try going for IVF. But it's a bit of a catch-22 because you can still, whilst you're waiting for the inflammation to settle, the endometrial tissue might grow back into the myometrium muscle wall. Final thoughts. If you've been told that you have adenomyosis, first of all, you want to know, how severe is it, doctor? Is it mild, or is it moderate, or is it severe? Because that will guide you as to what it is that you want to do. If your doctor at the first glance of the ultrasound, by the way, adenomyosis is diagnosed with the use of an ultrasound. If at the first glance of the ultrasound it is very severe, you have adenomyosis everywhere, go straight for what's more likely to give you a baby, surrogacy. For me, I think there's nothing wrong with surrogacy, so go straight for what's going to give you a result. There's no point of trying naturally. Now, if it's mild, I would recommend that you give yourself 6 to 12 months. If you have not managed to conceive naturally, then you should see your doctor. If you have recurrent miscarriages, 2 miscarriages is more than enough. See your doctor immediately because you may be dealing with adenomyosis. Finally, if you are trying to fall pregnant and you find that your periods have become increasingly more painful and increasingly heavy, see your doctor immediately. You will need a scan because you may have developed adenomyosis. That's all that I have for you for today. If you have found this video helpful, like it by giving it a thumbs up, share, and do show us some support by subscribing. Thank you for watching, and we will see you in our next video. In the meantime, watch all of the many contents that we have right here on Hey Doc. Take care, and we'll see you later.